Corticosteroids. In the last session of the corticosteroid first part, we will discuss up to the slide number 19, and now in this second lecture of corticosteroid we will discuss the remaining parts. The doses of the corticosteroid. Now, uh, what do you mean by the short term therapy? The patient needs a duration less than 2 weeks. If any patient take the corticosteroid less than 2 weeks is termed as short term therapy, and generally the short term therapy did not have any adverse effect. So short term therapy should be considered as less than 2 weeks. Long term therapy, the patient needs a duration more than 3 weeks is considered as long term therapy. So this is the most important. What do you mean by the short term therapy and the long term therapy? Less than 2 week, short term therapy. More than 3 week, long term therapy. And generally, most of the side effects are with the long term therapy. Alternate day therapy. Uh, in this alternate day therapy, double the dose and give it every other day to give a chance for pituitary to release adrenocorticotropic hormone to prevent adrenal atrophy and sudden withdrawal symptoms. Now, what is this alternate day therapy? In the treatment of the uh, chronic adrenal insufficiency or acute adrenal insufficiency. So, what is this adrenal insufficiency in the patients or in the persons? If the endogenous means in the body by the natural way, the endogenous secretion of the adrenocorticotropic hormones is not working properly, in this case, we have to give by the outer side, means in the form of the drugs, in the form of the medications. But what happened when we give from the outside, from the in terms of the medications, what happened generally, you should consider there is an the negative feedback mechanism in the secretion of the most of the hormones in human body. You should know negative feedback mechanism. Now, what is negative feedback mechanism? In this case, if if the blood level of the hormone is sufficient, if the blood level of the hormone is sufficient, so hypothalamus signals to the pituitary gland goes in this way that they tell to the hypothalamus tell to the pituitary gland, please stop the secretion of the this adrenocorticotropic hormone, because the blood having sufficient amount of hormones. So the secretion of the adrenocorticotropic hormone is stopped, which is endogenous, natural way. When when the sufficient amount of blood contain the hormone level. In vice versa, when the blood plasma or the blood level of the hormone is decreased, or we can say not sufficient, in this case the signal from the hypothalamus to the pituitary gland is to please secretes the hormone in the blood, because the blood did not have sufficient amount of hormone. And in this case, our endogenous natural adrenocorticotropic hormone works, release the hormone to the blood. And this is called negative feedback mechanism. This is the best explained by, that in our house, uh, there is in the on the top of the our house there is water tank. There is in the water tank, and uh, in the entrance of our house at the ground floor we have the water storage tank. In Arabic it may be called khazan, like this. And with the electric motor, what happens generally, this is the best example of the negative feedback mechanism. This is the best example of negative feedback mechanism. So please consider, our house, we have the at the top of our house there is a water tank. Generally it is white color. And in the ground floor we have uh, water storage. In the Arabic we can say khazan, with the electric water motor. So if you consider the top floor water tank is blood, and the khazan, we can say khazan is a storage. Khazan, we can say it is the pituitary gland, and electric motor is hypothalamus. What happen when the water level in the top floor of the our tank, top floor of house of the tank is decreased? There is an automatically signal to the electric motor, and it will start automatically to supply the water into the top floor of the our house, which contain the water tank. And vice versa, when the water tank above the our house is when it is full, when it is full, there is a signal automatically, an electric motor stop and not did not supply the water to the water tank above our house. This is the best example of the negative feedback mechanism. And same with these hormones. When the blood plasma level in human body is low, so hypothalamus stimulates the pituitary to secretes the hormone. And when the blood level of the hormone is high, sufficient, so there is a signal from the hypothalamus to the pituitary, please stop the secretion of the hormone. Now if you got this negative feedback mechanism, what happened when we take, any person take the outside medications which contain hormone for a long term? In this case, what happened, the blood level in the plasma, blood level of the hormone is maintained sufficient for the long time when any person take the medication from the outside for the long term, the blood level of the hormone is maintained sufficient for the long time. What happened in this case? When the blood level is maintained for the long time with the hormone, there is a no signal or we can say, what is the signal from the hypothalamus to pituitary? Don't secrete, because the blood having sufficient amount of hormone. So if the don't secrete, the pituitary gland is sleeping, sleep down, because what is the signal? Don't work, don't secrete, because the blood is having sufficient amount of the hormone level. And if it is having the long term blood hormone level is sufficient. And how it is sufficient? Because the person is taking the outside medication of the cortisone, prednisone, and due to this, the blood level is maintained normal. So what is the message from the hypothalamus to pituitary? Don't work, don't secrete the hormone, because the blood is having sufficient amount of hormone. In this case, if this pituitary gland is not able to work, it slip down, and if the person stop the therapy suddenly, if the person stop the therapy, that is medication which is taking from the outside, what happened? Now what is the signal to the pituitary gland from the hypothalamus? Please secrete the hormone. But what happened now? Due to long term slip down of the pituitary gland, it's not able to work properly. The long term shutdown of the pituitary gland, it will not secretes the hormone in sufficient amount. And if the sufficient amount of the cortisol, we can say the stress releasing hormone, is not secreted into the blood plasma, and this condition, the symptoms of the shock and hypotension occur, and this condition is called Addisonian crisis. Addisonian crisis, Addison's disease, or we can say acute adrenal insufficiency. Why this occurs? Why there is a acute adrenal insufficiency occur? Because because the person was taking long term medication from the outside, and due to long term medications from the outside, the medications means the prednisone, which contain hormone prednisone, prednisolone, hydrocortisone. Due to this, the blood plasma level was maintained at that time normal. Due to blood plasma level maintained normally, the pituitary gland signal to the adrenocorticotropic sorry, the hypothalamus signal to the adrenocorticotropic hormone, or we can say pituitary gland, is that don't work, because the blood is having sufficient amount of the hormone level. And if the person stops suddenly it stop the therapy, and when it stops suddenly, the adrenocorticotropic hormone did not wake up, because it is the sleep. We also human being, we are, when we are in the sleep, and if anyone say wake up, we are not able to wake up quickly. We need to at least 1 hour 2 hour to bring in the normal position. Same thing to the adrenocorticotropic hormone, it will not work and not able to sufficient the sufficient amount of the, not able to secrete the sufficient amount of hormone to the blood. And what happen then, if the sufficient amount of the hormone level is not happen in the blood, there may be the hypotension, there may be the shock, there may be the symptoms, and this condition is called acute adrenal insufficiency or adrenal crisis. We can say adrenal crisis or Addison's disease. So that's why it is recommended, do not stop the therapy, corticosteroid therapy suddenly. So there is a question, why the person on the corticosteroid therapy should not stop the therapy suddenly? Because it may produce the adrenal crisis, acute adrenal insufficiency. So what is the question? The person on the corticosteroid therapy should not stop the therapy suddenly, because it may produce the adrenal crisis. And what is the adrenal crisis? As I explained to you, same thing. If uh, I explained to you, our house which contain the on the top floor the water tank, and the ground floor which contain the khazan and electric motor. So electric motor is a hypothalamus, khazan is a pituitary gland, and the water tank is the blood. And if we have the sufficient amount at the top of the water tank, sufficient full, the water tank is full above our house, so electric motor not work. What is the signal? Stop, don't supply the water from khazan to the water tank which is above the our house. So what happen if we maintain the long term, our water tank above our house is full for the long term, supposed to be 1 month, 2 month, and after that if it will decrease the level in the water tank, and if there is a signal from the electric motor to the khazan, what happen? In some cases, you know that the electric motor is not able to work because it is not working from the many month. Same to the our adrenocorticotropic hormones. And in this case, this water motor is not able to supply the water to the above tank, because it should be working. If electric motor is working regularly, it will be okay. If it will be not working from many months, so when we start it is not able to work. And this is the same corresponding example to our adrenocorticotropic hormone. So what is my question? The therapy should be not stopped. The corticosteroid therapy should not stop suddenly to prevent the adrenal crisis. Okay, and that's why generally instead of giving daily dose to the person or patient, the best way, give the alternate day therapy. What happen in this? Double the dose. Instead of giving a daily dose, suppose example, the patient is, if the patient is taking 5 milligram steroid tablet daily 5 milligram. So best way, give one day, suppose Sunday, give 10 milligram, Monday no medication, Tuesday 10 milligram, Wednesday no medication, Thursday 10 milligram, like this. Double the dose and give it every other day. In Arabic, it is called Bad Bukra. Every other day, to give a chance for the pituitary to release adrenocorticotropic hormone to prevent adrenal atrophy and sudden withdrawal symptoms, which is called Addisonian's crisis, adrenal crisis, or acute adrenal insufficiency. So, what are the withdrawal symptoms in this case? Shock and hypotension are the major symptoms in the case of the um, corticosteroid withdrawal. So, this is the most important points regarding to the therapy of the corticosteroid. Now we have two preparation. Time release hydrocortisone tablets are available and used for the replacement treatment of Addisonians and the congenital adrenal hyperplasia patients. And um, in this week of the problem-based learning, we discussed yesterday about the congenital adrenal hyperplasia. And in the congenital adrenal hyperplasia, the hormones are not sufficient, or we can say there is no hormone in the patient, which may be due to genetically. And if the endogenous secretion of hormone is not sufficient, we have to give by the outside in the forms of the medications. And we can say it is an the replacement treatment. If the naturally endogenous, our body is not able to synthesize and secretes the hormone naturally, and if we give from the outside, it is termed as replacement treatment. And what is a replacement? Replacement means it acts like the natural one, mimics the action, and it produces the plasma cortisol level that are similar to those secreted normally in the circadian fashion. Circadian means our natural way, morning and the night, same. In the morning, generally, uh, now in the morning, what's your opinion about the secretion of the cortisol level in the morning and in the night? It is the same or different? And you know that the cortisol is a stress hormone. So when we have the maximum trace at morning or at evening or night? Obviously, we have the trace at morning. Suppose example, if you are the student, what is your stress in this time now? You have to attend the lectures, to attend the problem-based learning, to study the exam, to write the exam. So you have the stress in the morning. So you need the cortisol level high in the morning, and the at evening night there is a no trace. So you did not have the much amount of the cortisol in the evening and night. So this is the most important point. Second, we have the modified release prednisone tablet. It releases the drug approximately 4 hours after ingestion. Modified release, as the name indicate, modified release, and it releases the drug approximately 4 hours after ingestion. Means it is generally in the coating. This tablet is coated by this way. The coating means cover. The tablet is covered by this way. When any patient take this tablet, it will not able to break down in the stomach. It will not break down in the stomach, or maybe we can say it will the time required to break down, or we can say in the pharmaceutical term, disintegrative tablet require maximum 4 hour. Generally, the normal breakdown of the tablet, we if we take any tablet, normal tablet, it will take 30 to 40 minutes to break down, or we can say dissolution or disintegration in the stomach. How much time? 30 to 40 minutes to break down or to dissolve the tablet in the stomach. But this tablet is prepared in this manner, it will not able to break down in 30 minutes. It will take 4 hour time to break down. So what happened? It released the drug approximately 4 hours after ingestion, after taking the tablet. And this therapy is useful in the patient with RA. What is RA? Rheumatoid arthritis. The patient of rheumatoid arthritis. Now, why it is necessary? As it deliver the drug during nighttime hours. So, the patient of the rheumatoid arthritis should be suggested to take the tablet at the evening time. So what happened? After 4 hour means night, it will release the drug. And what is the advantage of the nighttime release of the steroid? It prevents the nocturnal surge in inflammatory cytokines. Nocturnal means nighttime. Surge, the formation of the inflammation means generally the rheumatoid arthritis patient feels the pain and inflammation nighttime more as compared to daytime. That's why, and if there is a nighttime pain, patient is not able to sleep, and there is a chances of the morning stiffness, and the patient in the morning is stiff, not able to move. So so the patient of the rheumatoid arthritis should be suggested take the drug at the evening. This prednisone tablet modified release should be taken at the evening, and it will release the drug after 4 hours means night. So what is the advantage? It prevents the nocturnal surge of inflammatory mediators, means it will not cause the pain and inflammation at night time, and in the morning it will reduce the morning stiffness, and the patient is able to work. The quality of life of the patient will be improved. So this is the therapy for the rheumatoid arthritis, important for your therapeutics point of view. So this is about the now corticosteroids also available in the form of the local therapies. Yes, just a minute. Local therapy of glucocorticoids. Now what is the importance of the local therapy? Local therapy means target drug delivery. Suppose example, for the patient of the asthma, we need the effect in the lungs. So why we should give the tablet by the oral route or by the injection? So directly we need to drug should be transferred at the lungs. In the case of the allergic rhinitis, we need the therapy at the nose, respiratory tract. If anyone having the dermatological problem, we need the therapy at skin. So why we should give the drugs or corticosteroids via the oral way or by the injections? So best way, give the only target What is our target? In the case of the dermatological problem, target is the skin. In the case of the asthma and the rhinitis, the target is the target is respiratory tract. And what is the benefit? Other benefits, if we give the local therapy to the skin by the ointment, cream, lotion, and the sprays, if we give the local therapy to the respiratory tract via the aerosols, what is the benefit? It will reduce the side effect, systemic side effect, blood side effect. It will reduce the systemic side effect, and it is also delivering the large amount of steroid to the only target area, and it will reduce the e- effect on the adrenal function and minimize the systemic adverse effect. Which are these drugs are available for the local therapy of the glucocorticoids? Beclomethasone, budesonide, flunisolide, and mometasone furoate are the corticosteroids used for the local therapy. Now the therapeutic uses.